live now.
Hi, good evening, everyone. Thanks for joining this webinar on employee health benefits. On the panel, we have some very senior people, and I would like to thank all the respected panelists for this webinar. And I would like to give a brief introduction about the panelists who are going to be discussing the topics today. Let me start with Ms. Rajita Singh from Broadridge. Rajita has been a management graduate by education and has been in the IT industry since 2000. She currently heads the human resources at Broadridge Financial Solutions. Welcome, Rajita. And I would like to welcome Mr. Sridhar Sarathi. Sridhar is currently serving as the Senior Vice President of Human Resources at Tata Capital. He leads the L&D, happiness, engagement, and corporate social responsibility at Tata Capital and has more than 20 years of experience in HR and marketing. Welcome, Sridhar, to the discussion.
Thank you.
And along with Rajita and Sridhar, we also have Mr. Amit Sharma. Amit is currently serving as a Vice President HR and member of the country management team at Volvo. He's responsible for providing strategic HR leadership across Volvo Group India. So we have a great combination of IT, finance, and manufacturing. Welcome, Mr. Amit. And also, along with all the respected panelists, we also have Dr. Ramesh, who's a senior cardiologist. And Dr. Ramesh Bhairapneni is currently serving as Managing Director for India Partners, venture capital fund focusing on technology and healthcare and life sciences. And prior to India, Dr. Ramesh was chief of cardiology and founder of Medwin Hospitals. Welcome, Dr. Ramesh.
Thanks, Kiran.
So the topic of today's webinar is something that is on everybody's mind, right? So we did a recent survey across a lot of HR fraternity and a lot of companies, and one of the top most important topic that is on everybody's mind is employee safety and employee well-being, right? And with that, we wanted to spend some time discussing employee health, particularly, and how employee health benefits have changed in the COVID situation, and would like to start off primarily with with Dr. Ramesh, right? Dr. Ramesh, from a clinical point of view, from your vantage point, what is the impact of COVID on employees and their families? I mean, primarily employees are also individuals, right? I mean, that you're seeing across India, and how are we coping up with it?
Sure. Thanks, Kiran, for the nice intro. Can I have the slides, Shashi? Some of these slides are not to scare the audience, but I keep the perspective. For example, for the first time ever, probably 10 years, 15 years, cardiovascular disease is always the number one killer. I've taken the US statistics because those numbers are far more accurate than the rest of the countries, especially India. This is the first time ever in the recent past that any other illness, especially infectious disease, became the number one killer. For example, in April 2020, COVID killed more people than the heart diseases in 1 month, 50,000 plus versus 50,000. Fortunately, the numbers probably will come down in the United States in May. Can I have the next slide? Shashi, can I have the next slide? This is just a very representative, again, not to scare, but I will tell why I put this slide. So far, 100,000 lives have been lost in United States alone. Why? I'll refer back to this slide again. Can I have the next slide? People are always thinking, Kiran, other panelists, that if you have a vaccine, we'll get over this disease. Or if you have a magic drug, we'll get over this disease. Normally, vaccine development is 10 to 15 years cycle. You need to identify the target, and then if this is successful, the pharmaceutical companies make a go no go decision, and then it goes to the phase 1 studies, phase 2 studies, phase 3 studies, and then it's launched into the market. The challenges here are no one will scale up the manufacturing facilities until you have reasonable certainty that this is going to be successful. Fortunately, in today's circumstances, because of the COVID, because of the extreme collaboration between the governments, the grant agencies, the universities, and life sciences companies, some of these phases are getting superimposed. So hopefully, people are claiming that we'll have a vaccine in a year from now or 18 months from now. Can I have the next slide? There are almost like 150 vaccine candidates being tried by various companies, but at the moment, at least 4 or 5 have already reached the phase 1. Even assuming we have a vaccine which is available, unless 60 to 70% of the entire world is immunized or vaccinated, it won't be able to protect. It's not the question of rich countries affording the vaccine. Unless all the poor countries also are vaccinated, the vaccine will not be effective. So there are so many unknown things are there. Next slide. Similarly, on the new drugs, I'm sure everyone must have heard about the Solidarity trial started by WHO. And similarly, there are 400 clinical trials going on. And especially all these drugs are known drugs like remdesivir, lopinavir versus ritonavir, interferon, hydrochloroquine. And I'm sure all of you are aware again that hydrochloroquine arm has been stopped by the WHO, the Data Safety and Monitoring Board. Unfortunately, sorry, I won't use the word unfortunately, even though ICMR still is using, asking doctors to use hydrochloroquine, the fact that the Data Safety and Monitoring Board asked the drug, that arm to be stopped, means they have found unfavorable effects in that arm giving these medicines. So I'll go back to the previous slide where I said 100,000 lives have been lost in the United States. Assuming even if you have a drug, we should not expect these 100,000 deaths will be prevented. At the maximum, any drug, if it produces 20% reduction in mortality, that's a fabulous result. So even if you have the best drug available in this country, this 100,000 deaths probably would have come down to 80,000 deaths. The same thing happens to the vaccine also. Even if you have a vaccine, if 70% of the world population also is vaccinated, we can't prevent completely the deaths. For example, even today in United States, every adult will get a flu vaccine. Still 100,000 people die because of vaccine. Now I'll come back to the next slide, which is far more important to this present symposium. Next slide, please. Next one. This is a very interesting example. A patient with COVID comes to the emergency department, then 125 hospital staff and patients get infected over a period of a month or two. A remarkable investigation at a South African hospital implicating stethoscopes, thermometers, BP cuffs again. I'm sure you must have seen similar examples, not only in the hospitals, outside the hospital settings also. Someone attended a conference almost in Boston, almost 3 months back, that led to 100 people getting infected. Next slide. And I think this is the last slide I'll be using. I don't want to bore all of you. On the extreme left, the one which I put in red box, in a Washington state, the church, 60 people are practicing singing at high voice a couple of months back. 52 of them fell ill, 32 of them tested positive, 2 of them died because of lack of precautions. Because at that time, 2 months back, none of us are aware what to be done. On the extreme right, Mass General Hospital in Boston, they employ 75,000 employees. two-thirds working on the site, rest of them outside the site, administrative staff. 11,000 people had mild symptoms. 1,400 tested positive, but very few fatalities. How did they achieve? I'm sure, I don't know how many of you have read this article by Atul Gawande, a surgeon and also a good author and a journalist. In medicine, we always talk of combination therapy, hygiene measures, screening, social distancing, not social distancing, masks, and culture. You skip one and the treatment won't work. And there are some mathematical models which say if you follow all these, when I say hygiene measures, frequent hand washing and use of sanitizers. Screening means not the testing by the public health officials. Screening is before you leave the house, check your temperature, ask a few questions. Do you have any symptoms? If you don't have, go to the office. Again, at the office entrance, check your temperature and answer all the questions. If you are normal, get into the premises. So, pure hygienic measures, simple screening procedures, distancing, and everyone uses a mask. If 60% of the world population can use this simple measures, 4 measures, and I think we can stop this pandemic. That's where the HR department comes in, processes needs to be set in. And on mask, one simple, what we need to use a cloth mask and a surgical mask. Basically, it won't protect you. I protect you and you protect me. If both the people wear mask, it helps. Whereas N95 mask with valves are only for healthcare professionals. And what is important here, for example, if you see operating room, I know it's challenging to bring that kind of culture into the general public. In an operating room, all of us will wear masks very properly. And there's a nurse which is going around in the OT. We call her the circulating nurse. Her responsibility is, however junior or senior she is, if someone is not following the sterile precautions, she will tell the doctor. For example, if someone wears a mask below the nose, she will tell the doctor, he may be the senior head of the department, doctor, you're not wearing your mask properly. Or someone will watch you from a distance, are you scrubbing your hands properly or not? The nurse will tell, you haven't scrubbed properly before the surgery. I think that kind of culture has to be brought in if we need to break this pandemic. And that's where the HR department has a great role to play. And the same thing applies outside the office premises, whether you're traveling on a bus or a metro, or you're walking on a street. The challenges are too many because of the education levels, hygiene levels, and economic reasons. But at least in the office atmosphere, we can easily control this. And again, to bring back the example which I gave you of a singing in a church which produced so many people, I think environment, there are some good examples. Even a restaurant, because of the flow of the air conditioning, one side of the people got infected, the other side where there's no air conditioning did not get affected. I think HR, the engineering and maintenance departments in various corporates have a major responsibility to oversee all these. So I will stop here, Kiran, and maybe once the other panelists speak, if there are any further questions, I can take. Thanks,
No,
Kiran.
absolutely. Thanks, Dr. Ramesh, for that summary, because there is a lot of information floating on the internet, right? So it is very what you mentioned is very relevant to the fraternity, especially from a people function, because lot of us this is an unknown for us, right? I mean, this is the first time that most of us are seeing an epidemic, and everybody is trying to resolve that quickly. I mean, currently everybody is in a crisis management mode, right? And coming to the crisis management mode, right? When we are talking about it, a lot of companies have implemented several measures immediately. I mean, it's just been 45 days or slightly more than 45 days that we've started seeing this in India. Now, let me go to Mr. Sridhar, right? Sir, in terms of when you've seen this, right? So starting mid-Feb is when you've seen US, we started hearing about in Jan, and I think in early March is when we started taking serious note of all the situation, right? What changes have you made within your organization organization from in terms of employee health benefits and actually protecting the employees. I mean, as Dr. Ramesh mentioned, it is a pandemic, right? It is a fast growing pandemic.
Thank you, Kiran. Good evening to my fellow panelists and to all the people who joined in, and thank you so much. Well, there are certain words or sentences that come to me straight away. When the pandemic took place at the onset of the pandemic. Irritation, frustration, angriness, boredom, being lethargic, anxiety, uncertainty. All these were words or thoughts that came into the mind of an average employee, and he or she did not realize what's going to happen, and what would the impact of this COVID-19 would be at the workplace. So, Shashi, if you could just take me to the virus. So, yeah. So this virus actually, believe it or not, over the last century or so, has actually brought the world to a pause. There have been huge challenges. There's been fear, uncertainty. Our daily work routine has been disrupted. Our so-called busy schedules, suddenly we've come to a place where we have enough time not only to spend for ourselves but also for our families. So suddenly we notice that how do we have so much time for ourselves? So work from home is going to be the is whether we like it or not is going to be the new normal. Uh, so therefore, keeping employees engaged through the lockdown is something which is very very key, not only for our company but for all the companies that are in existence, and where employees are the key. That is very very important. Uh, Before I go on to what we've done and what are the kind of policies that may come into place post COVID, there are certain expectations that all our employees have, and surely, as Kiran and Dr. rightly put it, safety is something that is very very critical for the employee and the family. It should be seen that we're extending support to the employees and their immediate family members during these difficult times. There is definitely a need for continuous engagement, whilst we may whilst we may whilst we may enjoy or feel that work from home is the new norm, is the new normal, etc. We also need to be continuously engaged with our workforce, our superiors, our subordinates, our peers, our and in fact all our stakeholders at large. There has to be a lot of trust and transparency in what we do. So you might have all the policies that you might launch or might introduce, but it has to be seen by the employee, especially if it's a multi-generational workforce. There has to be a lot of transparency and the trust that the company is taking care of the employee. Uh, Whatever we do, all the engagement activities, including revisiting of policies, etc., or the engagement initiatives that we do, need to be inspiring, need to motivate, need to ensure that the employee feels, yes, that this is the organization that he or she is working for. Last but not the least, given the time that we have and given that the skills might change in the immediate future, the requirements might change in the immediate future, there has to be tremendous learning opportunities to actually bridge the gap between the competencies that are required, immediate competencies, and the competencies for the future. Having said that, there's a lot of employee engagement initiatives that we at Tata Capital have taken. We've embarked on a happiness journey, and therefore there's a lot of initiatives that we do. The key amongst them are surely the leadership engagement, which starts right from the managing director and CEO. A plethora of employee communication, not only by the Tata Capital, by the Tata Group at large, a lot of emphasis on mental and emotional wellness and a physical fitness and nutrition. There's a lot of emphasis, a lot of mailers, there are a lot of hackdowns, there are a lot of fitness hackathons, etc. that we have, and of course we have a 24 by 7 help desk for employees who are feeling under the weather, feeling depressed, not feeling well too much in terms of mental wellness, etc. So we have a 24 by 7 help desk, which actually addresses in terms of counseling for themselves and for the family members also. Last but not the least, we need to keep the employees engaged, and not only them. Remember, even the employees' families are locked down in these times. So we engage the employee families along with the employees, and making sure that they have fun at the workplace. So what when we come to the off ask question, so is working from home the new normal? Yes, surely it is going to be the new norm, uh, mainly because of a variety of reasons, and of course, in terms of office rent, in terms of office spaces, in terms of traveling, in terms of cutting down on meetings, in terms of ensuring work-life balance. So there's going to be a lot of benefits accruing to both the parties, the employer and the employee. But surely the employees can expect a lot of changes. First and foremost is in terms of productivity levels or in terms of efficiency levels that are expected from them. What does the employee get in return? The employee gets added time to spend with the family, added time for physical fitness, added time to pursue hobbies that he or she could not pursue during a travel in Bombay, especially, or any metro for the metro where you travel 4 hours a day. So employees definitely have the advantage of that. There are a lot of traits that the employees are expected to display. Resilience is surely one. Adaptability, accountability, taking ownership, displaying of boundaryless behavior. These are the kind of new traits that the employees are expected to demonstrate because they're working from home. There is no 24 by 7. There's nobody as a watchdog, etc. And therefore, it's important for the employees also to take ownership and also to demonstrate certain behaviors that is actually beneficial for both the parties, but more importantly for the employees. There will be a lot of revisiting of new policies. Surely, policies such as work from home, which means increase in terms of medical wellness. Education policies, for example, employees will have more time to upskill. So therefore, there will be educational policy that can be important. There will be surely employee stock options, which can be the new policies that might come to existence for companies who don't have them, because of the fact that the talent that is there has to be retained, and when we have this kind of a talent which is unique, there has to be some retention strategies for that also. Will certain policies such as a car policy, such as a transportation policy be important? May not be as much as it is today, but these policies may not. But there are other policies, for example, a crash policy which was there initially. Now, if you're working from home, may not be as important for a working mother or for a working parent compared to the earlier stage. So there are certain policies that surely would be revisited. And when we look at the outcomes, definitely there is always a so-called an ROI or a cost benefit analysis, etc. that is done. But I think what's important is compared to the costs that are incurred, the efficiency. So we've seen across the organization for the last 2-3 months, for example, the number of training programs that we delivered or the number of engagement activities that we done, the percentage has just shot up. The online programs that we done is just shot up. So on the other hand, we're delivering all the programs digitally, but the number of employees who attend these programs have really gone up exponentially. So there are surely a lot of benefits. Efficiency is one, productivity is one, which is important. So the outcomes are far outweigh the costs, etc. There is a lot of time for physical and mental fitness, etc. So all in all, there would be a benefit in terms of a work-life balance, which is important. Last but not the least, surely the family also gets an opportunity to see more of you. You have an opportunity to grow with the children or be with the family more often than not. So that is definitely going to be an advantage. So what are the new policies that might happen? Uh, we are looking at there is a huge opportunity, because if you're going to be sitting at the workplace, medical surely is one important area. There is an opportunity for us to ensure physical wellness, so which means tie-ups with relative good gymnasiums or clubhouses, etc., for employees to have an opportunity to take care of their physical health. A lot of mental wellness workshops are anyway being done, and employees will do that. Child care policies, etc., might also come into work more because of the time that is spent, etc. Increase in surely Mediclaim, etc. That will happen. Uh, and last but not the least, since we are all going to work in terms of uh, from home for majority part of time, are there reimbursements? Is there an opportunity for reimbursement in terms of the time spent by the employee on the net? So therefore, Wi-Fi charges, etc., electricity, phone. That these are something that would be looked into. But surely, two or three areas that we are looking at is in terms of employee wellness, and therefore, whether it's domiciliary hospitalization, whether it is employee welfare. As a Tata company, we've always been ahead of the curve, ahead of what the industry norms are or regulations are, and we will continue with that. So as we speak, we were just looking at Ginger Hotels, which is a Tata Group company, actually contributing to COVID in terms of giving their hotels for governments to use them as possible care centers. But in terms of our company, yes, medical facilities will be increased. Stress levels, a lot of initiatives towards stress. So there are a lot of policies which are towards enhancing or decreasing level of mental stress, etc. Physical fitness and welfare is something that is very very looked at, and of course there will be a lot of reimbursement that we look at. But yes, which has to compensate also with. So it is going to be a matter of high performance. So people who are efficient, people who are more productive, people who are able to manage the time better, will definitely have the advantage of going forward. So that's what I had to say. I noticed that I've overshot my time, but I'll
No, no,
be
absolutely,
happy to take questions
Kevin.
later on.
Absolutely, these are all great points, Mr. Sridhar, and I think you brought up some of the interesting acronyms, right? And anxiety, you call it
Depression,
stress, you call it, and
depression,
it's depression. It's a great, and I think you brought up an important point, which is you're tracking happiness, which is extremely important in the current times because I think there's lack of that face to face interaction with colleagues, right? Yeah, the productivity might be on the higher side, but that personal touch is missing. And with that, I mean, when we are talking about some of these acronyms, I would like to go to Ms. Rajita in terms of, I mean, happiness. I think, I mean, I'm sure Broadcom also focuses more on happiness, and in fact, one of the things that you mentioned earlier, Rajita, was it was on a war footing to move from 4,000 plus employees overnight, right, from office environment to work from home, and I think there some of these acronyms you must have been hearing in the initial few days, right? I mean, because it's a new normal, people are getting adjusted to the new way of working from a company culture point of view. What are the I mean, what are the issues that you're seeing when it comes to mental wellness, and what are the policies, or what did Broadcom do differently to handle these issues?
Thanks, Kiran. Firstly, I just want to clarify it's Broadridge, not Broadcom, before I get started. The second thing, I just wanted to share some stats with regards to, obviously there's a lot of reading up that all of us have done. Doc has shared a lot from a scientific standpoint, and Sridhar's also shared some, but I'm sure Amit will also. There was a survey that was conducted in 2019, and this was even before COVID happened, right? And it was done by an organization called Buffer. It's a US based organization. In that, their poll was primarily about what do people think about work from home. 99% of them claimed that work from home would be awesome and we'd like to continue to work from home, right? And that's when COVID did not happen. And the reason was that at some point in time in their lifetime, they'd like to experience it because it would be a good one, and they'd get out of the stress of traveling to work, commuting, etc., and spend a lot more time at home, do their hobbies and stuff like that. Then came another survey, post COVID, again by Buffer. They primarily covered organizations like Facebook, Google, and Apple. It's an article that's been published, so you all could refer to it. They say that 56.4% of their employees said that they are suffering or on the verge of anxiety and stress because of working from home. Okay, Why is that happened? It's like, and I'll give you an analogy. I'm sure everybody's seen an ant hill, right? You have all the ants together. What happens when you throw a stone or you just kick it? All the ants are in a scurry and it's all over the place. I think that's what the pandemic, COVID, did to us in a century. None of us knew what's going to happen. It just came in, and we all had to behave that we are on top of it and we know everything, especially the ITs industry, right? Because we are leading the way. So we have all the answers as always. So I think that's something that, ended up hitting us a lot. In addition to that, I think also what's happened is there's a lot of emotional stress. What I'm seeing, not necessarily in Broadridge, but because I work with, a whole lot of other organizations as well in personal capacity and, with the NASCOMs and the CIIs of the world, what we are seeing is that people are coming in with personal issues. I don't know how many of you have faced it, but the rise of disciplinary action cases have, have risen in organizations. It is interesting, sexual harassment complaints have risen, being mentally harassed at workplace have risen. Okay, people have come with grievances across different organizations. Obviously, you have external members, so I will not name the organizations I'm referring to, but there have been several cases. There is one case that came to light last week where somebody tried to commit suicide in their hometown while being with family because he was being harassed because had to be continuously available at work, because the understanding from an employer standpoint now is it is my right. You're at home, you're not going anywhere, you better be available at my beck and call. And please note, I'm not talking about Broadridge. We are one of the top and great workplaces, so I will actually talk about what we are doing, but I'm giving you a scenario of what's happening and what I'm hearing. Okay. In addition to that, I think one thing that we need to understand, and what I have done at Broadridge is understand that it's a combination of the physical and the digital world. The term used nowadays is digital. So, because you need to balance the two and people are working at home, you need to come up with several things that complement both, people for the work that they do. It's not necessarily only policies, but it is primarily about their mental well-being. So, in addition to webinars and stuff like that, and on a lighter note, I know we are also on a webinar. There is a skeleton doing the rounds on WhatsApp University saying cause of death webinars. So I hope this one doesn't go down in that and people actually learn from what we are saying. But the fact is that you need to provide for people to take a break, take regular breaks, become a little mindful. There are a lot of EAP organizations. I will name a few, like One to One, like Silver Oaks, and like social organize, like the Social Org. They have developed apps. They have programs. They have counselors available for them where people could just pick up the phone and talk to them, because at times, while when you are in a crowd you can still be alone. When you're with family you can still be alone. Reason all of this is happening is very clear. So let's take work and let's take home. Okay, work primarily is a place where it's short term. You want to earn some money, you want to move to another place, so it's not quote unquote permanent per se, right? It is a place that could possibly give you stress because of deadlines. It's a place that could possibly give you excitement, could give you an overdrive of jealousy, whatever, depending on how well you're doing in your career. What is home? Home is a place where you relax. Home is a permanent place. Home is a place where you can actually just be yourself as family. Now, what's happened is work has come to home. Home has not gone to the workplace. And in that, the mental capability of distinction of being distinctive of when I have to switch off is a challenge. And for any habit to develop, it takes 21 days. It's scientifically proven, right? So for people also to get into the groove of work from home and what it takes a lot of time. So I'll tell you what we did at Broadridge. We rolled out a survey. We did it at two levels. One was global and one was local. Local means India specific across the three cities where we are present, to understand how people are feeling about work. Okay, so one was their side. The other, we wanted to know how their families were feeling about them working from home. And the third aspect was, do they really want to come back to work? Because obviously, with TCS and the other organizations and Twitter announcing no need to come back to work ever, TCS saying 25, 25, what do other organizations do, right? It's having a huge economic impact. So I think we wanted to get a sense of what our people are feeling. So we have now told people that, we will invite you back to work. Okay. So until December 2020, it's not mandatory for you to come back to work as long as you're able to do what you are doing right. There are a lot of things that obviously go in the offing. And I think we also need to understand, while we're talking from an HR standpoint, Moody's has downgraded India's GDP from 5.3% to 2.5%. So business will not grow the way it is. Rolling out policies, doling out money will not be possible for all employers the way it is, because you don't know, you don't have visibility on how your customers are going to respond to you, right? Especially in ITITS. So when you do things like that, so things like leave. Leave comes immediately because you say, okay, fine, you need some time off. It's a COVID leave. Some one of your relatives is suspected of COVID. You want to take some time off. You provide for those kind of leaves. You're working from home. None of the homes are actually meant to be offices. So how do you make it comfortable? Okay, working long hours, possibly provide for a work from home equipment, which would maybe tie up with an IKEA or tie up with a furniture world, tie up with the at home or something to deliver stuff to people. The other form is if somebody wants to do something, can't cook, is at a PG, sign up for the food to be delivered. Either, I know Zomato and Swiggy have been in the news for a long, for the wrong reasons, but possibly something equivalent to that where the food can get taken care of. Then provide for special insurances where people could actually get covered. The COVID leave, I believe that this is a huge market. I don't know how many of you know, but many health insurance organizations are setting up their captives now in India or expanding, if not anything. So there is, I think it's a combination of a lot of things. So what we are trying to tell our people are just three things, okay? And I'll call it possibly I. What I mean by I is, A stands for attention. Know what you're trying to do on a daily basis. Try to pay attention. Please give yourself the time off that you need. And you're at home. So for example, in this video, if my nephew walks in, I'm not going to be apologetic at all because I'm working from home. And it's nice for you to see somebody other than me, right? So I think the acceptance of that fact is very, very important. So accepting that is important. I stands for intent. I think people need to understand what is the intent of the work. Is it stress that, I want to take some time off? This will indirectly lead to mindfulness and stuff like that. But these sessions help a lot. Okay. And then the last I would also like to call is attitude. Attitude essentially means is, why am I wanting to do it? Am I curious? Do I just want to accept things the way it is and stuff like that? So I think these are, mota mota at a high level, these are the things that I want to call out. And just one last thing before I sign out is about, while I can say all this and feel all this, I think at the end of the day, it's each individual what he or she takes. So I can roll out policies. I can tell you I'm doing webinars on a daily basis. I'm not doing for associates only, I'm doing for family members and I'm doing for kids. And I know that the kids actually participate a lot more than my associates do, because that's the feedback that I've received. So from a brand will and repute, I'm getting a lot of it, but that's what it is. So with that, possibly we'll take some question and answers later, but that's what I had from my side.
Thanks, Rajita. I mean, Broadridge definitely has a tagline for employees where the broad smile, and glad to know that you're doing everything possible to actually keep up to that tagline, and and uh, and definitely, I mean, when we are looking at some of these, one of the interesting facts is, so we offer 24/7 doctor support through our platform to more than 200 companies. And in the last 1 month, what we've seen is almost 300% jump in terms of consultancies. And what is really interesting out of this 300% jump is almost 30% of these consultings are happening between 8 p.m. to 8 a.m. Right? These what we call graveyard shifts, right? So these are happening at those midnight, and it is and almost 70% of them are non-COVID related, right? So definitely, I mean, to your point, right? I mean, there is a lot playing on individual employees' minds, and definitely, I mean, some of the points that you suggested makes absolute sense. And now going to Mr. Amit. So, sir, in terms of, I know it's just like I said, it's just been a month and a half, 2 months. Like this is a new normal, and we suddenly started, as Rajita mentioned, threw a stone. If you throw a stone at ant, everything's like scattered, right? And now we are trying to come back to normalcy. And from a manufacturing point of view, right? From a manufacturing industry point of view, from a Volvo point of view, right? What is it that Volvo has done, learned, so that, I mean, God forbid, I mean, if the cases rise in June or July, as Doc mentioned, right? It's not going to go away anytime soon. What is it that you're implementing to ensure that it is in control, it is in check from a manufacturing point of view?
Sure, thanks. So what all of my other panelists said, and that's something which is very very relevant, and actually that gives me a good context towards sharing what I would like to share, and I would just like to kind of prime it by saying that this is a classic change curve. In a change management, you say there's a anger, there's denial, and then you start accepting it, and you start living it, and then you start kind of working with it as a new normal. This is a classic case of that which we have seen when the COVID struck us. We were in denial, that it will not happen in India. It's somewhere in China, somewhere in Southeast Asia. There were all sorts of theories. The doctor will pardon me for that, but I heard all sorts of stories like, hey, 25 degrees and above, the virus dies. So India is anyways a hot country. Nothing, this virus will not survive in India. Or Indians have a very high immunity because of we eat pani puri at the roadside vendors. So our immunity levels are pretty high. Nothing will happen. So we were in the state of denial, as a nation, as such, and the same happened the organization too, that nothing will help, nothing will change, and things will be normal, and India will remain insulated. And when we finally suddenly started seeing what was happening, and it just hit us, I would say like a tsunami, that people were just not prepared, and not prepared because of the reasons that they never thought they need to be prepared. And that's what really happened. So if you really look at it, what are the key lessons which we have learned in the last 1.5, or I would say 2 months now, because somewhere around mid of March we started looking at it. We realized that all our workforce planning is not there for the sudden uncertainties. We are just not equipped, as an organization, to plan for our workforce, which is in line with what is happening everywhere else. We can't really move up and down our workforce so quickly as it generally needs to be in such situations. Similarly, the work from home piece. In a manufacturing company like ours, we said work from home, not for us. We are not there. It's a nice concept for an IT industry. It works very well there, but we are a manufacturing organization. People need to whether be on the factory floor to work, and certainly we realized that in the last 45 days or 50 days, there's a much higher acceptability of work from home, and so much so that we are now actually looking at, do we really need to plan a real estate space for 100% of our workforce, especially in our corporate offices, in our technology centers, in our IT area. So that's something that's really been a new learning, and people have kind of accepted a different way of working as such. We've also realized that our comp and ben practices are very different. They are made, and Sridhar also mentioned about it. A lot of comp and ben practices were around coming to office, leaving your families back, or putting your child in a creche, or conveyance allowance, car allowance, and all of that stuff. And suddenly we realized that, hey, we really need to relook at it. A lot of it will not work in future, or maybe it needs to be tweaked in future. That's the only way it will be effective. uh, One of the big things which we found in the last 45, or I would say last 2 months, is the effectiveness of employee communication. This was a time period where everybody was under stress, more so in auto industry, because you hear companies saying, "Hey, we are laying off." Hey, large organizations in automotive are, the news headlines coming in about salary cuts, job cuts, and all of those stuff, and which really kind of freaked out people, to be very honest with you. And to top it all, our Sweden plant certainly went for 2.5 months of temporary layoff. The entire Sweden plant is closed, which is the mother plant for us. Our French plants are closed, our Belgian plants are closed. So with all those things which are happening at the back end, people were really scared, and that's when the effect of communication was very very strong. That we as a leadership team continue to communicate to people, saying, "Don't worry, no job cuts here, no salary cuts here. We are going to be standing with you, and we are going to take care of you in all situations." Even though for the people who need to come to office, there is enough infection prevention measures which have been taken. You'll be absolutely safe and sound. If you are having any kind of symptoms, stay back home. Don't worry. Don't think about coming to office. So all of that stuff, and the leadership kind of messages around, telling them what the business scenario is and how we are dealing with it. I think that helped a lot. So that's something which, though it's a, we know that in HR that employee communication how important it is, but in these tough times, how important role they play in case of employee engagement, that was a key aspect which really came out. Then things around how do you really ensure people are effective working at home. So in a general work from home scenario, which used to be there earlier, when people used to work from home, depending upon when they wanted to, like once in a week or twice in a week or something like that, they would still work from home. Means work from home, they'll work. Now what is, there is a situation where you don't have household helps, you don't have kids going to school, so there is additional element of taking care of your home also during the day, or somebody is coming in, to fix something in the apartment complex. So all of that stuff needed a different kind of a continuum. So if you really look at it, we couldn't expect for people to kind of log in at 9 p.m. and log off at 6 p.m. or 9 a.m. to 6 p.m. That was not possible. It became a continuum, which we started understanding. And we were accepting that. That's fine. So somebody can log in at maybe 9 o'clock, log off at about 10:30, do some household work, again come back at 12, maybe 12 to 1:30 is again working, 1:30 again he logs off. So it becomes a continuum thing till the time the output is clearly there, till the time the person's efficiency is there. There was acceptance of the fact that yes, people don't need to be logged in from 9 a.m. to 6 p.m. In the Skype, green light shouldn't be on always, because that's something is not what we are looking at. That became a key aspect which we realized. We also looked at the fact that our managers are not equipped to handle remote workforce. They are more equipped to handle workforce which is on a face-to-face basis. So it required a different skill set in terms of managing people who are not in front of you. So we had to kind of completely reskill our managers towards it, and we ran certain programs, learning programs, sessions, toolkits for managers in terms of how it is to be effective when you are working from remote and all your team members are equally scattered across the city or sometimes across the state. And then how and what does it mean for everybody else? So those things. How do you really engage with them socially? How do you really look at them? Have those fun sessions which we typically have. Those, how do we still have those coffee conversations? That was a completely relooking at the skills which our managers needed to have. At the same time, how do you really do your performance touch points with people? How do you really have those conversations as such? And in a scenario where you are not looking at person mostly face to face, you are just looking, you're hearing a person's voice in most of the cases because of bandwidth issue. Most of the people kind of switch off their videos. Then how do you really understand the emotions of the person? See, when I'm sitting face to face with an employee, I can see the reaction of what I'm saying, and I can kind of cool off and change my tone accordingly to kind of to ensure that it remains effective. In a scenario, especially when you're not even looking at a person as a manager, it's difficult for people to judge how it's being taken. And sometimes, after a session which can be a bit of a, let's say, a not so good session of conversation, you just take out a person and say, hey Joe, come on, let's forget it, let's have a cup of coffee and kind of relax and chill, or maybe go out in the evening for to have a beer, to kind of bring the person back to normalcy. You can't do that now. So how do you then have a different manage those conversation and those mindsets and those emotions? So that was a big change for us, which we realized and we kind of focused on as such. Mental health, Rajita mentioned about it, very, very critical aspect, primarily because of one is the fear of job, second is the fear of compensation, which we, for part of it, we continue to have that conversation that don't worry about it. But the third fear was about, is my family safe? If I would step out, and there are certain critical people who had to come to office for maintaining certain utilities or for maintaining some of our servers or who are supposed to work in the labs, they were those critical employees. So when they were going back, they were scared. Am I bringing back the virus home? And how do you deal with them? How do you deal with their anxiety? And that was something which was, a very different aspect which we realized, and we kind of took care of them, very, very effectively. We also realized that how do we really need to have employees' social needs as met. So just like in all organizations, there are a group of friends who go about on a cup of coffee in a conversation in the office, and maybe bitch about the boss or talk say something about the organization, and have those light fun moments. Certainly you can't do all of that stuff. So we kind of told them that you can still have a virtual engagement, use our IT tools, use our internal Yammer platforms or Microsoft Teams platforms or other platforms which we have, or Skype platforms. Have those virtual social sessions where you're not talking work and we're just doing interacting socially, and kind of making your social needs met as such. That was critical. One complexity which we faced in this entire situation, and being a manufacturing industry itself is pretty interesting, is about employee relations. Now, there is one aspect of it which Rajita mentioned about workplace harassment issues and the sexual harassment issues. Thankfully, we didn't face any of those. But the kind of issues which did come up, and they're pretty interesting, is that somebody, fell in his bathroom during the day, and his arm got fractured. Now, is it an accident during the work course of employment or not? And is company liable to pay compensation under the Employees Compensation Act or not? Or is the person supposed to be given some kind of a company time off after that because it happened during the course of employment? Or this is happening at home. Now, those are the interesting dimensions which came up. Somebody was having a, Skype session, with a beer can which was found on the table. One could see it in the video. Now, how do you see that? Call it drinking while in office, or you call it the person is still at home? So, is it a misconduct, not a misconduct, a done conduct, or not a done conduct? Those are interesting dimensions we also kind of dealt with, and none of us were kind of prepared how to deal with it, and we had to kind of relook at it in very different perspective around it than we would have taken it in the normal course of session. So those are some of the things which kind of we dealt with, and we are kind of managing it going forward on that. And maybe I'll stop here at this point of time, and then maybe happy to take certain questions around this or anything else going forward.
I'm very, very interesting. I mean, very, very, very interesting and very precise challenges that you have with respect to manufacturing. Right? And just last week, after a very tough day, my entire core team sat together late night having a happy hour on a Zoom call, right? So I think there's change in behavior, what we call pre-COVID and post-COVID, right? So those terms are now common. So I think there's complete change and phygital, right? So of course we didn't get to cheer, but yeah, but those are little things that are actually keeping everybody going. So while there are some questions coming up, right? So one of the most important question I think everybody's on everybody's mind is, I would love to hear quick um, feedback from the panel here. Is from your company's point of view, and Dr. Ramesh from a public health point of view, when is everybody thinking the normalcy would kick in, right? When is back to work even reality, or is it still far away, too uncertain to talk about now? Let's start from the clinical point of view, Dr. Ramesh, right? I mean, is it just couple of months away, or is it a year away? What do you think? I
My
think you're.
feeling is probably. Can you hear me?
Yeah, yeah, please.
Can you hear me?
Yeah, yeah.
Yeah, I think my assessment is we should be careful for the next 12 months. And why I said 12 months is not because a vaccine will come, as I mentioned, or a miracle drug will come. 1 year, basically, for the virus pandemic to just die down by itself. And to me, the biggest scare, I think all the panelists were talking of work from home. I'm more worried of if people start coming back to the offices, the transportation, how safe they will be, and at work, how to make sure the workplace is safer. And you have seen examples of restaurants because the air conditioning entire one half of the people sitting on one side. Those are far more challenging issues, I think. So I think we have to be mentally prepared for 12 months. I'm not an expert to comment on the HR issues, work from home, but I think someday or other people have to come back to the offices. And what are the safety measures we need to take? That's very crucial. And as I told you, if I can bring the operating room experience to the office, that's fabulous. But that's very challenging. Even in the hospital, you'll see the class four employee, she will put a glove and go around the entire hospital for 8 hours. She's thinking she's protecting herself and protecting everyone else, but is spreading the disease. That kind of a cultural change to come in the entire organization is far more challenging to break this epidemic or pandemic.
And from Broadridge point of view, Volvo and Tata Capital, I mean, from the panelist point of view, what do you think? When are you guys thinking about coming back to work?
So, from our point of view, you see, we've been following the norms that have been set up by the respective authorities and governments. So, of course, there are already zones that have been identified, demarcated, do's and don'ts, etc. In spite of that, it's a safety first approach. For us, the employee comes first. His or her safety is of prominence, predominantly. Their safety is very, very key. Even in the green zones, so we've actually identified, the percentage of employees who should be coming. It's every alternate day. It's more need based. It's not about, I'm a senior executive and therefore I should be there. So even if I'm senior and if I'm not required to work from the office, I don't come to the office. There are do's and don'ts. People who are parents above 60, people who have children less than 5, people who have certain diseases, BP, diabetics, etc. So all these parameters that we have, we've requested employees to give those, and only then do we permit them to come. And it's not every day. And last but not the least, there is no public transport, and even if you come on a two-wheeler, you have to be alone. Or if you come in a car, maximum people that can come in a car is two. So we have a very, very robust SOP, and we've actually requested employees to follow that SOP. Surely we will penalize employees who don't follow the norms, because we are going. It's for us. It's very important that the safety of the employee is very, very key. So I've not actually been in the office, though our office has opened for I think the last 15 odd days. I've not been to offices yet because I don't think my role demands that I be in office. So therefore, I have not been there. But yes, once as Dr. rightly said, there is no urgency to rush into office to show that I actually work out of office. I also work out of home. The question is, as it slows down, as the disease is more or less under control, then we will take a call on how many employees. So I don't think in the next 6 months we will have 100% coming in. If we feel there are certain roles that can operate out of home, we will continue with that, because it benefits both the parties, the employee and the employer. And if there is increased efficiency, so last 3 months we've seen increased efficiencies, as I mentioned before. So if there are increased efficiencies, why not continue with that? Because of course there's a cost element also involved there. That's how we.
Excellent, thank you, Rajita.
So we have, yeah. So we've actually asked people to come back only after December 2020. And we said we will invite you over. So it's totally up to them. If they feel comfortable, they can come back. And for that, we've also come back. We've formed committees and excoms on return to work, reimagining work. And we're also, because it's a behavioral change, right? So there are a lot of training programs that we're conducting at ourselves, at our site, to actually get people more accustomed to what to expect when you come back, because cafeterias are not opening and stuff like that. So yeah.
And I think thanks, Rajita. From manufacturing, I think a couple of plants have opened up. And immediately opened up, and they immediately shut off. What are you seeing?
Now, from a manufacturing standpoint, we do need to start because manufacturing can't work from home. If I have to produce a truck or a bus or a construction equipment, I have to start my plant and then only do it. But we have been taking a very, very measured approach around it. In terms of calling people to our manufacturing sites. Only people who are surely needed to manufacture are coming. And the roles which are not, we're calling it internally facing roles and externally facing roles. The roles which are very clearly facing internally on the manufacturing piece, only they are supposed to come. And all the roles which can work remotely, whether it's purchasing or HR or finance or supply chain roles or managerial roles as such. All such roles we are saying, hey, let the person continue to be at home. A larger guidance is people have to continue to work at home, and it's only on the people who are very, very essential only are required to come to office and come to our plants as such. We have also put, as Sridhar was mentioning, strong protocols around it, taking declarations from people if they have any kind of medical conditions. We're saying, oh, please don't come, stay back home. If you're saying if anybody has had a travel history, we are saying stay back home, please don't come. If you have small kids, stay back home. If you have aged parents at home, stay back home. So those are the things. If you don't have your own transport, please don't come to office. So those are the kind of filtering criteria we have kind of put in around it. It does pose a challenge because sometimes there are some critical employees who can get into this zone of not supposed to come and they are required. We are trying to kind of use their expertise more from a remote standpoint, and but rather than risk their lives and also risk others' lives, as far as coming to office is concerned. But we have also done one thing, primarily from a leadership standpoint, and for the people who have to come to office, especially manufacturing, not office much, but who have to come to the manufacturing sites. We did, once a week, one of the country team members we are saying should go there and kind of, tell them that we are with you. It's not that we've kind of brought you here and then we are all, trying to be safe at our homes. So just to ensure that their motivation, engagement, the fact that leadership is standing with them when they have been asked to come, we are also standing with them. So we are kind of doing that also once a week. One CMT member at least goes to the plant and kind of spends some time at the plant and comes back. But yes, taking all the precautions and all the norms of infection prevention and social distancing and everything.
Excellent. I mean, one of the interesting points that you mentioned yesterday, Amit, is while in technology and IT and other companies, we can move around the chairs and provide that social distancing in a fixed manufacturing setup, right, which is already fixed and you can't move around. Yeah, some of those challenges are very unique, and I think it's only time will tell, right? So excellent point, guys. At this point, I just wanted to open up and ask the rest of the audience if they have any questions for the panelists here in terms of the particular topic. So, please post them on live comments so that we can answer them. So while we're waiting for that, there was a question that came in earlier Par Excel, right? Uh, what are the new trends in corporate wellness program that you're seeing, right? From Kritika Jaiswal, Par Excel, in the post-COVID situation.
You want me to take that?
Yeah, please.
Okay. So because So just to give, just to go a step back. So employee wellness is surely one of the key, uh, leading to happiness. And in these days of so-called stress, etc., employee wellness has always taken prominence in what we do. Well, let's take a small example. Last the full of last month, we've been doing signature workout hacks, and basically it's an exclusive virtual wellness session that we organize through a famous wellness coach for our employees and their families. Uh, you know, if you'd asked me 3 months back, I would have said, this would not be engaging, this would not be entertaining, this would not be liked by the employees, this would not give the desired ROI, this would not be cost beneficial, etc. And how do we actually follow somebody on the net or streaming, etc.? But this has actually happened, from a physical environment to exclusive virtual wellness session, where you get in much more than what's happened actually in the in the physical sessions. So surely these wellness webinars, etc., will be uh, the way to go ahead in the future. When we are speaking about mental wellness, that again is a big uh, is a big strength in terms of an online learning, because of the fact that now employees are not only going for a counseling session or undergoing a counseling session over the phone, but they're also encouraging their family members during these times of stress. Children's studies, for example, children's exams being postponed. So therefore, there's an opportunity for children, the family members, the parents who are not well, undergoing. So this mental well-being during the crisis is helping to cope with anxiety, panic, managing social distancing, etc., stress management. How do we take care of elders, kids, etc., building resilience. Last but not the least, Rajit also mentioned about creating mindfulness. So I think as more and more employees, especially the younger employees and the senior generation employees, get an opportunity to work from home, these kind of activities also will go online, and it is for us as employees to make the most of this. So I think this is the way ahead. And last but not the least, there is no the seats are not limited. So it's open to not only 100, but it's open to 1,000. So therefore, there's an opportunity in terms of scale, in terms of reach also.
I'd just like to add to what Sridhar said, is that earlier in the organizations, health was primarily physical health, and that's what we were all focused on. All the insurances were around physical health as such. All the programs were around safety was around physical health, keeping safety from that perspective. The mental health piece is something really come up now, which was earlier I saw only in Europe. In European companies, especially in the headquarters, we saw a lot of focus on that. I see, a high focus now coming to India around this particular aspect. And as Sridhar said, most of the good companies, including ours, are spending a lot of time now to focus on this aspect of health and wellness, and not just the physical health.
And for one of the interesting trends that we are seeing when we are talking to our existing clients and the HR fraternity is today, one of the interesting trend is as work from home is the new policy, right? And it's not going to go away anytime soon. What we're seeing is most of the employees have temporarily migrated to their hometowns, right? It could be in tier two, it could be in tier three, tier four in certain cases. And like you mentioned previously, it was more physical, right? All the wellness activities like yogas and everything used to happen in one office space in a physical location. Now, with everybody scattered across multiple locations, there is more focus on virtual care, right? Which is how do I provide unified benefits to my employees, irrespective of their location, where they can access anytime from anywhere. So that is a new trend that we are seeing when it comes to employee health benefits, right? I mean, with, like you rightly mentioned, virtual fitness, doctor consultations, which is teleconsultation, which just skyrocketed in the last 45 days, mental wellness programs, pregnancy care programs, right? Currently, I mean, if you look at pregnancy women, they're the ones who are also prone to virus. So now they cannot go out and meet the doctor for small, minor questions. They need to access doctors for some of those queries. Then the other areas that we're also looking seeing is basically uh, not only that, even from a specialist point of view, right? So everything that we used to do from a physical point of view, even like pharmacy, right? Everybody is looking at home delivery of pharmacies. Everybody is looking at, even when some of the employees who used to have health checks done, going to the diagnostic center and get a health check done, are now saying, can you send the person home for a sample collection, right? How do you provide a uniform, unified care, irrespective of the location where they are, and more importantly, provide it across India, right, from tier one, tier two, tier three, and tier four. So that's where we are seeing the trends where everything is going to be digital, and as much as possible, it's very scattered, right? With that said, I mean, excellent point. Thanks panel for excellent points. Let's take one more question from one last question from the audience, right? So one of the questions that came up, I think we covered it, but I think if we could hear from other panelists is how, God forbid, but how do we prepare the workplace for future crisis situations? Right? I know it's gleaning too far ahead of time, but any thoughts here? This comes from Sarita from Indian Institute of Human Settlements.
You see, we've always spoken about earlier days. We would speak about disaster recovery, PR. Then we spoke about BCP, business continuity planning. In a way, we never expected that this would happen sometime in our lifetime, right? And therefore, we never spoke about crisis management. So now we are better off. I mean, at least we are so-called experts in as to how to handle crisis. So in a way, there's always already been something that's happened before. Anything else that can happen worse than this. Uh, Question is, there are always blind spots. In your scenario planning, in your strategic planning exercise, there are always blind spots, and crisis is something that doesn't come tell you that I'm going to target you from tomorrow. But yes, there are things like what we learned today is in terms of employees do like to work from home. Yes, employees have an aptitude to learn from home. Yes, employees have an opportunity to take care of their mental and physical health, which is from home. So there are a lot of things which we thought could only happen as a classroom style of or a physical way. So yes, it becomes more mechanical. That's one point which I wanted to mention, in the sense that you don't get time to speak about your family, you don't get time to speak about good times, you don't have time to make fun of each other. It's very mechanical when you get into a call and you speak, on a Zoom or team meeting, etc. You're to the point, but I think it saves time, and that's where efficiency and productivity come in. So there are a lot of lessons that we've learned, and I'm sure all of us as individuals and as companies would have further benefits. And of course, that's where the best practice sessions come in, as to how we could handle crisis far better than what we did. Having said that, I think most of us have been pretty agile in handling scenarios in this scenario. And but for example, there's been very minimal job losses in many of the companies that I've been discussing with. There will be practically no salary cuts in our group, which is another way of encouraging the employee. But yes, crisis is something which we need to be prepared for, and we need to adapt ourselves. So I think one thing that is very clear is we constantly need to evaluate and improve on our processes, and that's how we could manage on the crisis. For example, if you're sticking on some processes which suit you well in a particular situation and it's not been revisited, then I don't think we'll adapt ourselves when a crisis does strike. I mean, a crisis is a crisis because you're not prepared. If you're better prepared, then it's not a crisis. So I think that's how I look at it.
Excellent point.
Kiran, on the same subject, certain, for example, the frontline workers, hospitals, police people, sanitation, industries or workforces have far more challenges. I'm sure none of the panelists are from that we probably were fortunate, but the frontline workers, that's a real challenge for the governments, for the people who are working in those areas. That's really challenging, even for this epidemic. Forget about the future epidemic. Yeah.
Excellent point.
One thing I would like to add here is the we do make all these BCPs and and all these crisis recovery plans and all. And I'm sure after this, all of in all our companies, COVID will also become one of the points in the business continuity plan, and we'll also kind of create a SOP and process around it. The problem which I see in organizations is that the institutional memory is short. The fact that in a few years down the line, when the managers will change, people will change. Suddenly, there'll be new set of people coming in. That that transfer of knowledge doesn't happen that effectively in many organizations, and then there is a chance of this getting lost out somewhere, and we may again be facing a crisis somewhere later. We all have seen 2007-8 financial meltdown, and every company created a plan around it, that what we need to do if suddenly there's a crisis, a financial crisis. Today we had a financial crisis, with the orders drying down, the customers are not buying, the revenues are not coming in. It's a major financial and the cash flow crisis, but people were still not prepared around it. So the problem here to me is, how do we really going forward ensure that whatever learnings we have done and whatever we are putting in here, it passes on in an organization, and that institutional memory remains strong, irrespective of who the current incumbent is. And I think this is something which organizations really need to do well. Then only they'll be prepared for the next crisis. Otherwise, we must start from zero again if it happens, let's say 15 years down the line, with some other situation.
So I just want to add on, Amit, thanks for saying that. I want to share something what I came across through BCG around the 8th of May. They had actually published a report. It doesn't say that it's a quick fix and it's a cheat sheet for you that these are the top 10 things you can handle any pandemic. But I think it provides you with very different perspectives with regards to how you can manage such a situation. So there are two parameters that you need to look at: your current capabilities and what is of strategic importance to you for the next 5 years, 10 years, 15 years, based on your organizational evolution where you are, right? And as part of that, they've identified 7 parameters to look at. One which talks of smart work, where it's about remote work, it's about facilities, it's about lower cost. Second, it talks about physical and mental health. So obviously that's on the priority for any employer today. Then flexible workforce. We've been talking of gig economy since 2010. Not too much has happened, but there is a possibility that gig could be on the rise because of this. Then a new paradigm for skill and talent. Over here, what we mean is there's a lot that's happening on learning. I think Sridhar also spoke about it. How do you create an adaptive learning ecosystem? I think that is very important. Just giving random digital learning systems will not help. But how do you create the ecosystem around it is going to be critical. The fifth is about leadership with head, heart, and hands. Okay, I think many a times we get stuck, and there's a lot of stuff that's been written about servant leadership and stuff like that. I think what kind of leadership do you have in your organization, and how is your organization viewing it, is going to be very, very important and critical. The sixth point is about the purpose and driven culture. How do you align all of these parameters across the two sets? Lastly, being resilient and bionic organization, wherein we talk of how do you simplify your operating model. I think that's going to be the key. So I call it the 3 S's: simplify, it has to be scalable, and you have to have speed. So that's my 2 cents on that.
Absolutely. And thank you so much. I think we are at the top of the hour. Thank you so much, Mr. Sridhar, Ms. Rajita, Mr. Amit, and Dr. Ramesh, in terms of spending your time sharing your knowledge, and more importantly, best lessons learned from your point of view with the fraternity. I would like to end the session with one small feedback that we received from the audience. Right, let me just read it. Right, before joining the webinar, I thought it would be the same as other webinars, talking the same and nothing will come out of it, a waste of time. But it turned out to be great, and I didn't feel like leaving it in between. So one of the audiences, one of the HR fraternity has written, and she loved it, right? She's still on. So thank you so much. I mean,
Thank you.
it's slightly different from most of the webinars that we've heard, but it's good to know coming from you all. Thank you so much. Thanks for your time.
Thank you for having. Thank you so much. All the best. Thank you. Bye.
Thank you. Bye bye.
Bye.
Bye.